Hello, and welcome to De-Risking Healthcare. Today's episode is a conversation with Dr. Anu Banerjee about the role of risk management in healthcare, risk management burnout, and steps that he has taken to prevent such burnout. First, let me say our sponsor, SafeQual, has all sorts of software to help you pursue excellence. They really know what they're doing and have reinvented what software should do to make you and your healthcare system more productive at improvement, risk management, safety, quality, and compliance. They also believe in supporting this channel, so go visit them at www.safequal.net. Good morning. How are you today?
Doing well. How are you?
Very good. Very good. To get started, would you summarize for our audience what functions are performed by the risk manager and the risk management department?
Absolutely. Happy to. Thank you for having me here. So some of the key functionalities of risk manager in a healthcare facility are to develop the risk reduction strategies after they analyze the high-risk areas in the healthcare facility. And these risk management functionalities are extremely critical within the healthcare institution to mitigate risk and improve patient safety across the institution. Now, risk management, if you run it efficiently, could be implemented and absolutely could reduce the amount of litigations, as well as reduce or eliminate the patient safety harm events in the clinical areas. The risk management, hence, could be very pivotal to develop key strategies within the organization, and this could only be done if they collaborate and build relationship with other leaders and staff members across the institution. Now, there are many types of risk management that could be actually implemented within a healthcare institution. One of them is actually enterprise risk management, and this could help you to create many staff members and have them operate as risk managers itself in their own areas. So basically, you develop risk managers within the institution rather than creating just a risk management department. Now, it's not always responding retrospectively to events. So remember that risk management could be a lot more than that. This could not be just follow up on complaints and patient harm event. But that's a kind of in a nutshell what risk managers actually do for healthcare institution.
Why do healthcare systems depend heavily on the risk management department?
That's a very good question. The risk management is actually one of the most critical functions within the healthcare institution, as I mentioned before. One of the most important functions within the healthcare institution that they actually do is to follow up with an event with a root cause analysis, also called an RCA or an RCA square methodology. These methodologies are actually used to understand why did the problem actually happen. And they understand the why behind the problem just because they have been doing this for a long time, as well as they need to understand these root causes to reduce and mitigate risk within the institution. So following up on this is an extensive and a detailed task for every risk reduction strategy that could be efficiently maintained. We need to discover these risk reduction strategies for serious adverse events. Just like retained foreign body objects, which could be very important for the institution. These could be also serious sentinel patient events as well. There are still multiple cases of retained foreign body objects after many years of RCAs have been performed on these that are left in the body every year in the United States, which could lead to serious or moderate harm to patients. Now, the role of risk management here allows healthcare systems to minimize or eliminate these serious patient harm events. So healthcare systems could be impacted through these events, not just by losing millions of dollars on litigations, but also the reputation and the culture that takes years to develop within a healthcare organization. So risk managers and their role can help them to actually mitigate this kind of a risk. And hence, healthcare institution could develop a just culture environment by implementing effective risk management and help cultivate the safe culture within the healthcare organization.
Why do you think there's burnout in this sector of healthcare?
So this is interesting. This because risk management could be a very busy role, as well as they are very critical within the institution, and they could be utilized in many factors of this institution as well. So we may see that risk management could be very busy following up on events that could be collected by these incident reporting management systems. Now, risk management departments are usually leanly staffed within healthcare systems, requiring them to be very efficient, keeping the manual interventions to the least. And hence, they require efficient tools and methods that will allow them to do their job very efficiently. And this could require productive tools and many other tools to collaborate with other leaders across the institution. Some of these tools could be providing assistance with RCAs, lean tools like PDSAs, and claims management tools to reduce some of their manual intervention in their job.
What measures should be taken to reduce the burnout of these valuable people?
That's a great question again. I think we need to keep these people within the institution. We need to make sure that we reduce their burnout within the institution. The efficient RCA tools could reliably investigate for root causes with the frontline staff without being punitive. And these kinds of tools could actually help risk managers to reduce some of their burnout as well. They could perform risk management, risk assessments in high risk focus areas. And this could develop strategies and mitigate risk based on heat maps, and these tools could provide these heat maps and provide solutions for them as well. And these tools could also hold the employees accountable within the institution on a day-to-day basis. And this allows the risk manager to focus on the key functions rather than holding people accountable within the institution. These tools can also help risk reduction strategies monitoring to prevent these patient safety harm events, which could be very beneficial to the healthcare institution as well. Now, monitoring claims, these seamlessly monitoring claims, these tools can help in that process as well with the least manual intervention. And this allows to obtain these loss run reports electronically and many other reports that risk managers could end up spending hundreds of number of hours to create these things.
Can you expand more about accountability?
Absolutely. Accountability within the healthcare institution is extremely important because there could be multiple RCAs that are being performed within the healthcare institution. At the same time, we need to make sure that the risk reduction strategies that are identified needs to be completed. Healthcare leaders are already very busy with their regular operational duties, so want to make sure that accountability is still into the system, holding the managers and the leaders accountable to complete these risk reduction strategies. Otherwise, it will be very hard to prevent these events moving forward.
How do you trust people throughout the organization to do the root cause analysis as good as you would as the risk manager leader of the organization?
Risk managers would be always involved in an RCA process or risk reduction strategy process. The reason is that it's a very structured process to understand the why behind the problem. Hence, the frontline staff and managers and the leaders would be still involved, although risk managers would be facilitating these RCAs so that they could structure them well and the outcome could be actually utilized to prevent the next harm event.
Could you contrast the difference between risk management and quality in a healthcare system?
Absolutely. That's a great question, Dan. Risk management is more on the risk prevention and the risk mitigation side of the healthcare system, where they are trying to protect the hospital from those events happening within the institution, whereas quality is to actually improve the quality within the workflow or the current patient care models that are actually being implemented within the healthcare system. So quality acts on the clinical care side of it, whereas risk management would actually act on the events that are happening after the care has been provided. Or risk management would help to prevent those patient serious harm events while the care has been provided. So those are the two big differences, I would say, between risk management and quality.
And from the prevention side, risk management sounds very similar to quality to me. So if we're just talking not the reactive things that risk management does, but the proactive, what's the difference or similarities?
So risk management would actually identify those proactive things, but quality would be actually helping to implement those things. Risk management will never be playing a role in implementing things within the healthcare institution. That's where quality comes into picture.
I understand that. Now, patient safety and quality also have some overlap in prevention, right?
That is correct. Patient safety and quality does have some overlap. At the same time, quality is not just looking at the patient side aspect only. The quality also have to look at the technical aspects of providing care, the staff aspects, the providers aspect as well, not just the patient safety aspect. So quality is very, I would call it as a full circle of healthcare, where patient safety would be only focusing on the patient side and making sure that the patients are safe.
I see. So if I'm a unit manager at a hospital, I interact then with all these other different departments. It almost seems, or do you think it ever seems like you're dealing with five different quality departments, especially when you bring in compliance, for example?
Yeah, sometimes it could feel like it. And that is where I think streamlining in healthcare is extremely important. Reducing these silos is extremely important in healthcare because of the same exact reason that you mentioned. And understanding some of these tools that we could probably allow to streamline some of these initiatives. Otherwise, you're going to see that these initiatives are being run by multiple people in different areas, such as compliance, quality, patient safety, risk management, even leaders within their own area. So we need to somehow bring them together and understand that how we could collaborate these initiatives. Some of these tools that are available out there now could help us to do that.
If you could only choose one tool, would you choose a tool that is more enterprise risk management focused or one that is more quality process improvement focused?
At this point, I think healthcare institutions are not there, or they're not matured enough to actually implement enterprise risk management immediately. So quality and process improvement is where I would actually choose that tool from, and then eventually go to the enterprise risk management state later.
If you could consolidate from these five departments to fewer departments, what would be your choice?
I think quality stands as number one, along with risk management, helping them. Those are the two departments that are extremely key to the organization to balance the patient safety harm events versus the quality workflow that needs to be implemented. So I would choose those two.
Mhm. Why do you think enterprise risk management is too difficult to be implemented?
It's a big commitment, actually, from an organizational aspect to implement enterprise risk management within the institution. And commitments like these take a lot of resources, as well as making sure that there are dedicated resources that are being hired to implement initiative like this. Organizations are not built to be heavily resourced at this point with all the cuts and the reimbursement issues that are going on. So I think at this point, healthcare institutions mainly perform these functions using lean departments. And that's difficult for enterprises to implement an ERM, enterprise risk management, across their institutions.
Is HRO and ERM mutually exclusive?
Yes, they are. They certainly are exclusive in terms of understanding HRO. It's more of a culture-wide, organization-wide culture change, whereas ERM is an implementation strategy to mitigate risk across the organization.
Can you split the baby? Can you have HRO on the clinical side and ERM everywhere else?
It's hard to actually split that because HRO works as an umbrella, as a strategy within the institution, whereas ERM is one of those functionalities that you need to develop to become an HR organization. So it'll be very hard to split that.
I see. You mentioned a couple of times having some tools. What kind of tools would you recommend either for ERM or HRO, functionality wise?
That's a great question, Dan. HRO tools are extremely useful for organizations to understand their current state, where they are. Even if after they implement HRO, years after, they need to know where their state of HRO is. HRO could be sliced into three different pies, and tools that allow to make these pies happen, which could be Lean Six Sigma tools, their leadership tools, as well as risk management, safety, culture. These tools could be very helpful to understand HRO within the institution, their current state, as well as implement strategies, and then finally understand where they land after a few years of HRO implementation.
Mhm. So can you describe to me the functionality you see in ERM software then?
ERM softwares are not very common in healthcare facilities. ERM is more of a strategy that they need to implement. So you need to implement some slices of ERM within the institution. So some of the tools that you could utilize that could perform RCAs, PDSAs, FMEAs, these tools could be actually utilized in multiple areas within the institution and then could be brought together as an ERM model. But you don't want to implement an ERM software across the institution. That would be my recommendation.
Understood. Yet these ERM tools they do have modules for root cause analysis and patient safety.
Yes, they do. Sometimes they do have modules for these software. These software tools do have those modules, and they could be very helpful for healthcare institutions.
Would it make sense if they have such software to discontinue using those modules and then use modules from another application? Or does enterprise risk management mean you've got to use all their modules?
I don't believe so. That doesn't exist in healthcare at this point. Healthcare institutions are not developed that way. There's many silos still exist in healthcare, and to develop ERM-based software or implement an ERM-based software across all modules would be very difficult for risk managers as well as other leaders within the institution. So taking small bites at a time with RCA tools, FMEA and PDSA tools would help the healthcare institution to get there.
You've introduced an HRO tool to a hospital in the past. Talking about burnout, was there any aspect of implementing that reduced burnout?
Yeah, the manual intervention within healthcare is extremely high. When you implement software tools that could reduce some of those burnouts, it actually helps healthcare institution quite a bit. Manual interventions like Excel sheets are still being utilized in healthcare tremendously. So when we implemented HRO within an institution, it always helped us to reduce the burnout from those critical people who could be utilized in other areas rather than just putting in data within an Excel sheet.
In what other ways do software tools reduce burnout for risk managers?
I think one of the most key important things is to make sure that the outcomes are being reflecting change within the healthcare institution. So you do need to see the needle moving. The only way you do see the needle moving is by holding the people accountable and making sure the risk reduction strategies are being completed. These tools could be actually very helpful in those two areas.
Inside HROs, there are risk reduction strategies as well.
Absolutely, yes. Risk reduction strategies is a very critical part of HRO. Holding people accountable and making sure that the percentage of risk reduction strategies completed is something that the board as well as the leadership needs to monitor. And that would help the HRO state to advance further for that institution.
Now, you mentioned software tools are able to help move the actual function of accountability from risk and quality managers into software. What does that look like? How does software hold people accountable?
That's a great question. Software alone cannot hold people accountable, but it can certainly send reminders, making sure that they monitor, as well as the data that could be shown within the software could help the leaders understand where the fallouts are. And those are some of the things that could help accountability make better within the institution.
What are symptoms of burnout that you've seen in risk managers?
Some of the symptoms of burnouts are high turnover within the risk management department. Efficiency could be actually reduced. The productivity could be reduced. You're going to see redundancy in the same events over and over again. Patient safety harm events are being seen in the institution repeatedly. When you start seeing these things, you can immediately see the risk managers are going to get burnout within the institution.
I see. Do you have a personal experience you can share of a risk manager being burned out and things that were done to reverse and keep them as an employee?
There has been some instances, may not be exactly the similar one, but in the past, there has been some instances where risk managers do get burnout. And the idea was to actually streamline their work in terms to understand their manual interventions are less, and they're being motivated to do more process improvement projects, risk assessments that could help mitigate risk rather than just reporting and following up on those events. To reduce some of those redundancies within their work, they could be inspired to do something else. And I have utilized those methodologies to keep the person within the department and help the risk management department.
Do you ever go for any outside help when you encounter somebody being burned out at their job? And is it different for risk managers?
Yes, there are resources available from outside. There are institutions are actually available at a national level as well, where you could utilize some of those resources to either train or help your risk managers to understand risk management well, as well as help them to with their burnout and their stress levels. But some of these resources could be utilized to understand risk management better. At the same time, if you help the risk management department or the risk managers to understand the culture within the system and help them with the tools that could be utilized to reduce some of their manual intervention, I think that's a great way to start.
I understand. In our audience are risk managers. What would you suggest they could look for in themselves to recognize symptoms of burnout?
If they are continuously doing the same task over and over again, if they are seeing the same events happening within the institution repeatedly, this is where they see that these burnouts going to actually happen very soon. So they need to identify these things ahead of time and talk to their supervisor that how could they actually reduce some of these things and efficiently work out these burnout issues.
Could they make a case to go get some of these software tools as a solution to their higher ups?
They certainly can, and some of these software tools could help them. So they could certainly make a case that I could reduce some of the burnout of chasing leaders to complete their risk reduction strategies. And these kinds of statements or problems could arise within the institution that could reduce some of these burnouts within the risk management department.
What if I recognize burnout in some of the risk managers working for me? What kind of resources can I get for them if I can't get them software tools right away?
True. Not every hospital system could actually afford to buy software tools and just implement it immediately. Some of the things that could be utilized is to just simply perform risk assessment tools using paper and understand data across the system that is already available. This could help them to focus rather than go across the institution and try to fix every area within the healthcare system.
I understand. How does the risk and quality departments make a ROI argument for better tools?
So it's always been a challenge for quality and patient safety staff to ask for resources for implementing such tools. It's never going to be a case that there's a clear collaboration between finance and quality to convert these events into hard dollars. Although there is a huge commitment that the organizations and leaders make to improve quality and patient safety across the institution. That's the first thing that will allow the finance people to understand why is it important. Number two is there are many programs like value-based purchasing that implements penalties across the institution. And these tools sometimes could help to reduce some of those penalties for institutions, for healthcare institutions. And I think some of those things could be utilized as an ROI to ask for resources or efficiency tools for quality and patient safety.
Can reduction in burnout be used as a ROI for these tools?
Absolutely. Training an employee and hiring an employee is a huge cost to healthcare institutions. So reducing burnouts, improving productivity hours could certainly be utilized as a return on investment within an institution. It may not be very clear in terms of how do we utilize this ROI, or should we see this ROI immediately in the near future, but it certainly could be a good factor within the ROI calculation.
The reduction in burnout, does that just apply to the risk managers?
No, it could apply to many other people like employee health and safety modules or other clinical leaders that are actually utilizing a lot of their patient care time towards these risk reduction strategies. They may not have to do that anymore. So they could focus on their patients rather than focusing on these manual interventions they used to do before.
Is there anything else you'd like to add for our audience today?
No, that was it. Thank you so much again for your time.
Thank you.
Appreciate it. Thank you, Dan.
Hey, thanks for listening. If you want more, be sure to click like or subscribe. If you'd like to appear on our program, be sure to fill out the SurveyMonkey below. Most important though, if you know someone who should hear this video, please forward it to them so that together we can all work to make healthcare just a little bit less risky.